Morning, ladies and gentlemen. Good afternoon. You may be somewhere else. Good night. Good evening. So, good evening, ladies and gentlemen. Good morning. Good day, ladies and gentlemen. My name is Mubarak Yusuf, and this is the question of the day. So, basically, there's a question, and the question is saying a 37-year-old man presented a primary care physician with his wife. His wife complained of cough, night sweat. Her temperature is 102 degree Fahrenheit. That is, she has fever. She said she traveled to South Asia 3 months ago. Her X-ray showed cavity lesion in the right middle lobe, and the PPD means purified protein derivative show 16 mm in duration. PPD test in the husband showed 10 mm in duration, but chest X-ray is normal. Which of the following is the mechanism of the drug the primary care physician prescribed for this man? So this is a third step question. First, you have to know what's wrong with the wife. Then you have to know what drug do you have to give to the husband, and then second, you have to know what drug to give to the husband. Then third, then you have to know what's the mechanism of the drug you have to give to the husband. So basically, this woman, night sweat, cough, fever, traveled to endemic region of tuberculosis. So the wife is having tuberculosis, and the husband will be considered as a close contact, right? So if the husband is considered as a close contact, you have to prophylax the husband. And the drug which you use for prophylaxis in close contact with tuberculosis is none other than your isoniazid, right? So, but let's walk through this. And when we look at the option A, our option A, it inhibits DNA-dependent RNA polymerase. This is the work of rivampin. And rivampin, what do you know you use rivampin for? You use it for prophylaxis in Neisseria meningitidis, and also in prophylaxis of H. influenza, right? So also in Neisseria meningitidis, in case if rivampin may be costly, so you can also use ciprofloxacin, Cipro, and also you can also use ceftriaxone also. So B, which is isoniazid, and this is the answer. The answer is B, isoniazid. And C is our aminoglycoside. And one interesting fact about aminoglycoside, that is the only protein synthesis inhibitor that is bactericidal, that it's killed the bacteria. And D is our chloramphenicol. So after we all know the drug now, we know the answer is B. So I would like to work on the main common side effect of each of the option. Our option A, most common side effect is the red-orange coloration of the body fluid. For example, the patient will be sweating, sweat will turn to red, tears will turn red or orange. And another question that could present on our rivampin is a patient using OCP. If a female is using OCP and she's taking rivampin, she will be pregnant because rivampin is a cytochrome P450 inducer. And B, one interesting question they used to test about this is the peripheral neuropathy, and they will test you on what will you use to treat the peripheral neuropathy, and that will be B6, right, the pyridoxine. And your aminoglycoside, you know, it has a side effect of ototoxicity and nephrotoxicity. And also you will want to know that you won't give it with cephalosporin because that it will exacerbate the nephrotoxicity. Then our chloramphenicol, you know, the common side effect, very interesting side effect, that is the gray baby syndrome. And also it can also cause aplastic anemia. And basically that's it for this question, and I hope this helped. Thank you very much.